Some baseball trivia on today's podcast. Hi, I'm Neil Gordon with Augusta Business Daily. But who is this gentleman blindfolded? I'm going to have to ask a question. A bald baseball player. Did you ever perhaps play in a championship, MLB championship series?
I did, Neil. And did you just call me bald?
No.
Okay.
Because you have a beard.
Thanks.
And this gentleman has ties to Augusta. Are you Cal Ripken?
I am not.
Former owner of the Green Jacket.
I'm not.
Oh.
Close.
So why are you coming here today blindfolded?
Well, that's a great question, Neil. I would say it's good to see you, but I can't really see you right now. So
Understood.
I wanted to talk a little bit about health insurance and what the insurance companies want you to see. Right now, I can't see anything, and that's how most companies approach their health insurance, because that's what the insurance companies want them to see. They don't share any data, and what data they do share, if you're large enough, it's the data that they want you to see. I have a hard time being a consultant working with those parameters, and I know that insurance, companies that provide the insurance have a hard time making a decision. Health insurance is now one of the top 2 or 3 items on a P&L for business owners, and they're going in blind trying to make that decision. So I wanted to play a little game and just have a little fun with how we approach it. It's really difficult to make a decision this way. I wouldn't buy anything like this. You could be selling me a Lexus, or telling me you're selling me a Lexus, and when I pull my blindfold off, it's an old beat-up car.
Oh.
Not a good way to approach the market. So I, as a firm, are trying to change that mentality and trying to expose the why behind insurance and help my clients understand why they're purchasing the insurance and what they're getting.
Well, we have a little hint as to who this gentleman is. Can you see above my left shoulder, it says, the Pennant Group. Could you remove the blindfold and share with our audience? Ladies and gentlemen, Mr. Tom Mastny.
Yeah, most people probably want me to put the blindfold back.
No, not at all. Why do you think insurance companies have this blind leading the blind type mentality?
We don't have enough hours to get into the details of it. But really, if you look at our economy as a whole, our economy is in a recession. But over the last 10 years, the one industry that has not been in a recession and continue to not be in a recession is the insurance industry. Their stock prices have gone through the roof ever since the enactment of the ACA, or as we know it as Obamacare and the ACA. Insurance companies have been making money hand over fist for the last 8 to 10 years, and they don't want us to know why they're making their money and how they're making their money, but we as consumers, I think, have earned the right to that.
And if you'd like to learn more about clearly how innovative Tom is, just go to thepennantgroup.com for more information. And I'm assuming, Tom, this gets passed down to agents of the insurance companies, and they have to make a choice just like you. What do I offer to my consumers? So what do you try to do that's a little bit different?
Yeah, to me, it's setting expectations. It's setting the expectations from an agency, but it's also setting expectations from a client standpoint. I want them to know how our industry works, why it works, so then as we approach renewal, they have a better understanding of what their consultant should be doing, and then what the expectations of the employer should be. As we approach renewal in the state of Georgia, we get kind of backed into a corner. We're given 60 days to make a decision. And normally we get our renewal from the insurance carrier 60 days out. If we're lucky, it's 75.
Okay.
But in that two-month span, we have to meet with the client. We have to address their issues of the health care that they have, and then go to market, as we call it, which is to look at all the other carriers in our market and get quotes from them, and then present that to our employer. And if they need to make a change, then we have to do all the paperwork behind the scenes give the option to their employees. We are really squeezing this into a 2-month window, which turns into about a 2-week window, which doesn't leave a lot of room for error. Not a good way to approach the situation. It's very stressful on both sides, and a lot of things fall through the cracks. My goal as an agency is to fix that as much as possible. I think all brokers and consultants should be proactive. They should be having regular conversations with their employer groups, and the employer groups should expect that. If we're having conversations throughout the year on our market and what health insurance is doing in our market and what we're seeing from other carriers, that at least is a proactive conversation towards renewal, which allows the renewal process to be smoother.
And you're kind of planting a seed along the way. Just from your experience in the CSRA offering employee benefits, what are some types of things that can change after someone has had insurance for a while and then they go through the year? What would impact it?
One thing that gets looked at on a regular basis from the carriers throughout the year, and most employees don't know this, and most employer groups don't see this, but their prescription drug list that is covered, what drugs are covered and how they're covered by that carrier, that changes twice a year. And that happens behind the scenes, and that can affect the copay throughout the year that employee pays when they go get a prescription. That's not talked about. It's not understood, and there's a reason behind that. That can be a completely different series of podcasts when we get into the pharmaceutical side of things. That's really where the change needs to happen. That's where the transparency needs to occur. That's going to be the hardest fix.
Well, if you don't want to be in the dark on your health insurance and employee benefits, your most valuable asset, go online to thepennantgroup.com. It's a very impressive website with a lot of options and resources. And then Tom would be glad to meet with you. Thank you so much for the time. Appreciate it.
Anytime, Neil. Appreciate it.
And, of course, we're a service of Get Up Productions, and so pleased to have the podcast filmed here in downtown Augusta. But they're available to help really in any area for any organization or a business. Here are some of the social media ways you can get in touch with them. Tell them Neil sent you. I highly recommend them.